Well, 41 leading tobacco control and addiction experts from Australia and New Zealand, including academics from right here at the University of Newcastle, have signed an open letter to Federal Health Minister Mark Butler calling for an urgent rethink on Australia's vaping crackdown. The instigator of that letter and one of the signatories is Dr. Colin Mendelsohn, a clinician, academic and researcher in smoking cessation and tobacco harm. He joins us now. Colin, thanks for doing that. Good morning.
Yeah, good morning, Paul.
We've spoken in the past about your support of vaping as a tool to get people off smoking. Do you still support its use?
Look, vaping is the most effective quitting aid we've got. For smokers who can't quit, it's the most effective and most popular quitting aid. So it certainly should be available for adult smokers, absolutely.
All right. How do we protect children, though, as part of that process?
Well, we need to regulate vaping properly. The current prescription-only model means that adult smokers find it extremely difficult to legally access vaping products. So we've created a huge black market that sells dodgy products freely to adults, but also to young people. And this prohibition model just isn't working. We need to regulate it in a way like other Western countries where it is working, which enables adults to access these products but minimises access for kids.
Colin, I understand part of your argument is the fact that prohibition has never worked ever for anything.
That's right. That's right. I mean, we just know from history, and we're doing the same thing again. We know that when you introduce harsh restrictions and bans and prohibition, people find a way around it. The black market, the criminal gangs, there are always ways, and you can't eliminate a product that way, but you can replace a black market with a legal, regulated one. And if people can get these products legally, and they're high quality, and they're sold through licensed outlets to adults only, they will buy them from those outlets, and the sale of these products to young kids will diminish. And that's the big problem. Kids are getting these products, they're not for kids. They're an adult quitting aid, which should be available like any other adult product for adults who wish to quit.
Is the world a better place with vapes in it at all?
Absolutely. What we're seeing in other countries where vaping is more readily available is that smoking rates are falling faster than ever. Vaping was legalised in New Zealand, for example, in August 2020. Over the next 2 years, as smokers switched, the adult smoking rate fell by 33%, which is just unprecedented. In Australia, the smoking rate falls by 1.7% per year. So yes, I mean, smoking is the leading preventable cause of death and illness in the world. And anything we can do to help smokers quit, I mean, we have to support that. But at the same time, we have to also protect young people who don't smoke from vaping. It's not for them. But if we regulate it so harshly that adults can't get it, we're overall doing a lot more harm.
The bottom line is, though, that vaping's not good for your health, is it? And that's where the Federal Health Minister should come in, shouldn't he?
Well, what do you mean by it's not good for your health? If you're a smoker who switches to vaping, you dramatically reduce your exposure to toxins, you dramatically reduce your toxic chemicals in the body, and your health improves. So from that point of view, compared to smoking, it's enormously more helpful. Of course, it's not harmless, and there are risks. There are small amounts of chemicals, but only a tiny fraction of what's in smoke. Smoke vaping is at least 95% safer based on the chemicals that we know at present. So look, it's not risk-free, but nothing is. There's arsenic in tap water, there's carcinogens in coffee. Everything has risk, but for the people for whom it's designed, it's a huge step forward for their health.
Colin, how difficult was it to get 40 co-signatories for this letter that you've written to Mark Butler, the Health Minister?
Look, it was difficult in that a lot of the people that we spoke to who were supporters were not willing to sign because they're government employees, or they rely on government funding for their research, or there were career concerns. I mean, they were coming out against the groupthink and having to say, well, I don't believe in what my employer or government's saying. And so there was resistance for those reasons. But the people who signed are very senior leading experts in the field who are willing to speak out. And there are a lot more. These are the ones that I know that we approached. but there are many others, I'm sure, who support this. And certainly, it's interesting that in Australia we have this attitude to vaping, which is very negative. There's much more support in other parts of the world where, the research is showing that it's an effective quitting aid, and that the population level smoking rates are showing it's working.
But we have this sneaking suspicion that big tobacco's behind all of this, don't we? Is that an unfounded fear?
That is an unfounded fear. It's commonly used to denigrate vaping, but the fact is that big tobacco didn't invent vaping. It controls about 12% of the global vaping market. It had to come into the vaping area because it had to compete. It was losing all its customers, and if it switches from cigarettes to vaping, that's a good thing. We wanted to make fewer cigarettes, big tobacco, but we can't make that happen. But if it transitions away from them because it has to switch to a more competitive product that's replacing it, that's a good thing.
Colin, just explain how your best practice model would work if you were to control the distribution of vapes but still permit them. How would that look?
Yes, that's the question, and that's what we would do is mostly follow the New Zealand and the UK example. So it's working very well there. So basically, you have licensed retail outlets which sell vaping products as adult consumer products to adult smokers. So there's strict age verification, you have harsh penalties, loss of license for underage sales. And so these products are available for people who smoke without a prescription, so they can readily access them. But there is strict enforcement of underage sales. So it's just like any other adult product. It's like going into the service station to buy your cigarettes. You're meant to be asked for your age verification, and in general that happens.
Paint tins in a cage at the hardware store, another example.
That's right. You would perhaps put it behind the counter. You wouldn't have it promoted and advertised. Although there is some argument for point of sale promotion to make smokers aware that this is available as a safer alternative.
The language that Mark... Sorry, go on.
That model's working well in other countries, and we're seeing as the vaping rates go up, smoking rates are falling, people are accessing them. There's always going to be some leakage to young people, but I think overall we have to look at the overall public health benefit, and there are enormous benefits to adults from immediate and substantial benefits from quitting, and the risks to young people are concerned, but they're quite small in comparison. Oh,
is that fair to say, though? We're very concerned looking in the community at the age of some people who are holding vapes and vaping, the access to them through their parents, for example. It's a major social concern, isn't it? The exposure of vaping.
It is a social concern, but the evidence says something quite different. And I know this is going to be controversial, but the large numbers of people we're told are vaping, we have to break that down into, were they smokers to start with? And if they are, it's probably a good thing that they're vaping. And how often are they vaping? The vast majority of kids who've never smoked are vaping infrequently and short term. So the harm from that is limited because they get limited exposure to toxins. So that's the first thing. Were they smokers already, and are they smoking frequently? Secondly, there's no evidence that vaping causes kids who wouldn't have otherwise smoked to take up smoking. We keep hearing that kids who vape are 3 times more likely to smoke. Well, that's not because they vaped. That's because these kids are more likely to take risks, they're more likely to drink alcohol, they're more likely to use drugs, they're more likely to smoke. And the research is showing now that it's not a gateway.
Now, can I just ask you about, obviously the language that's been used by the Federal Health Minister Mark Butler has been quite assertive. I can't imagine this letter's going to change his mind. I mean, it doesn't sound like a thought bubble policy.
It's a policy based on misinformation and fear, and it's a political decision. If you look at the evidence, I think it's quite clear, and I think the 41 experts in Australia who've reviewed this evidence, for us it's quite clear that this is a bad public health decision. The existing model we have is not working, and we can't pretend that we're just going to patch that up and double down on it and make it work. It just isn't going to happen. It's highly unlikely to improve. The black market is just going to continue to thrive and sell these products to young people. And I think a lot of the statements that Mark Butler said are not evidence-based. He says young kids are 3 times more likely to take up smoking if they vape. Well, that's very misleading. He says that the under 25s are the only age group where smoking is rising in Australia. That actually is not true. The smoking rate in that group is falling faster than the general population, and they have the highest vaping rates, and there's a strong link there.
Colin, I don't want to get into numbers because I don't have the numbers in front of me, so I can't dispute what you're saying to me. But I take your point that you believe that it's not a good public health measure. I appreciate you coming on. Thanks so much for sharing your thoughts with us today.
My pleasure. Thanks, Paul.